Hello, my name is Bemister and I'm a respiratory therapist. I just want to do a quick demonstration of what's called external CPAP. So I've done a video already on high flow nasal cannula, and the idea would be if you only had one gas source, you would need a bag valve mask, and the patient, you would leave them on their nasal cannula. So normally to do bag valve mask ventilation, you would connect the bag itself to oxygen flow. But in this case, we're not going to do that. We only have the one oxygen source. So what I'm going to do is connect the oxygen from the nasal prongs and then turn the flow up. And if I turn it up to very high flow, the patient wouldn't tolerate this very well if they were conscious. But if in preparation for intubation, I wanted to do external CPAP, the high flow is flowing into the patient and the pressure is just being released into the room through his open mouth. And then when I put the bagger on, to close the system, I'm applying a small amount of CPAP there. You can see it on the pressure monitor. So that's, the PEEP valve is set to 5. By holding the mask over his mouth and getting a good seal, I can get a CPAP of 5 with the patient. And if that is not giving him adequate oxygenation, I can actually increase it by turning up the PEEP valve. And as you increase it, you'll increase the ability of the patient to get oxygen from the system. And what it does is it builds up the pressure inside of the patient, but only to the level that I've dialed the PEEP to. So normally the PEEP valve would start at 5, and then I could adjust it from there based on what the oxygen saturation is. So it might take a few people to do this, but it could be easily done in a setting where you have limited resources. Maybe you don't have a BiPAP machine or ability to do CPAP in any other way. You can do it just with the bagger like this. And then depending on what their saturation is, you can increase the PEEP level or CPAP level from 5 up to 10, 15, 20, and each level would give you a larger and larger lung volume for oxygenation. But the pressures are kept low. When you're bagging, a lot of times the pressures are so high that the air will often go into the stomach and cause more problems. Using this type of system allows you to use very low pressures but very high flow rates, and it's a very effective way to oxygenate people that you wouldn't otherwise be able to oxygenate. Typically, you would lay somebody flat and bag them with the bagger using high pressure, and that will often go into the stomach. In this way, I'm able to give them low pressure with high flow and keep them sitting up, which works better for their lung mechanics as far as oxygenation and absorption of oxygen in the system.